Hi, my name is Monica Blaylock, and I'm going to do my service learning vlog number 3. I don't have my cameraman today, so I'm going to do it just like this. So let's get started. Question A. How has the health crisis caused you to become more aware of your own privileges and necessities? I think that healthcare is very important for everyone. I am very fortunate to have an employer who is able to provide insurance at a decent cost. Compared to private insurance, though even with insurance, people who get sick and have to be hospitalized for anything serious such as the COVID will be left with a hefty sum to pay. So can only imagine what it would be like to be hospitalized without insurance. It's basically going to ruin your life financially if you cannot afford to pay your hospital bills. For example, a coworker of mine had to have emergency surgery to have his gallbladder removed, and he has the same insurance as me, and he was in the hospital less than 7 days and is so far has accumulated medical bills of $46,000, and they're still coming. My husband recently had a torn valve in his heart due to a tooth infection that went to his heart, and he was in the hospital leading up to the surgery for numerous days, and so far his hospital bills have accumulated $100,000, and they're still coming. So I've lost count. So unless you are wealthy or have some sort of government or private state insurance, you're going to be with a financial burden of not being able to pay your hospital bills and not be able to get credit for a very long time. That's why I think it's very important that we have universal health care, especially at a time like this with people in and out of the hospitals, staying long at the hospitals. Who knows if they're able to pay their medical bills or not, and it just becomes more of a financial burden for them, especially with everything that's going on. If they're not working, they're not making money, and they are not being able to feed their families. So it becomes a really big burden for them. And that's just not one person or just a group of people. That's pretty much a lot of people across the United States in the world. So the second question, question B, how does the current state of our society and world impact you, your family, your friends, and those who rely on service provided by the community with volunteer and service learning participation, i.e. soup kitchens, food pantries, homeless shelters, after-school programs, recreational centers, Special Olympics, assisted living, and hospice? So I can only imagine that food banks are having to minimize the people allowed in due to COVID and the restrictions of COVID. That would cause less mouths fed at a time, that they even may have to reduce their hours to keep their employees safe as well, or the volunteers that are volunteering at soup kitchens and homeless shelters. And in regards to homeless shelters, they are probably having to limit the amount of people in because they're having to separate the beds and whatnot just to be in code with the COVID restrictions and requirements that have been set in place. So I imagine that people who go to food banks or to get a meal are not getting a meal every day, or maybe not getting a meal more than once a day. So my children are in school. They attend city school, and I get notifications every once in a while about requesting food bags to be sent home. While in quarantine, there were pickups that you could go and pick up food for your family. I think it was once a day. I didn't actually attend those, but I did get notifications that they were available. So as far as I know with that, I think that is still very much an option with people with children rather. So people who do not have children, I don't know that would be an option that they could pick up food from the schools because they're not technically feeding a child. So in regards to senior centers, when I was looking for my pen pal, I did not, I'm sorry, I'm going to just let my dog out real quick. I tried contacting a senior citizen center in my area and found that it was still closed. So I don't know that that means senior citizens wouldn't been able to go down there and take part in their activities. That was early September, so hopefully they have opened since then. So my mother-in-law is in a retirement home, and it's a very nice retirement home. She has her own room, bathroom, and they have a rec area, an outside area. But now I take her flowers and candy and snacks every once in a while. And when I go in there, I'm not actually allowed in the door, but I can hand my items to an employee and they will be taken to her. I look around a lot and see it just looks similar to that to a ghost town because everyone's always in their rooms. The dining area has plexiglass up so that you can still see the person, but you are not allowed to touch them because there is plexiglass in between. And it just really makes me sad. She was recently had to quarantine mandatory because she was around somebody who had tested positive for COVID. And I really felt so bad for her and everyone there because when we're at home in quarantine, we can go from room to room. We can move about, we can go outside, but these people, the residents, I don't think really have the option to do so because there's so many people that live there coming out in the rooms, they would still have contact with each other. So it really makes me feel quite sad, and I just feel for them in hopes that, this goes away really soon so that they are able to get back to some sort of normal life, because they're already technically quarantined to confined to a building. And before they could come and go, but now residents aren't allowed to have family members. They're allowed to be seen by doctors or go to the hospital, but then they have to come back and be quarantined for a while until they're allowed to come out. So I can't even think about what it would be like to be admitted into a hospital and not having anyone, my loved ones, come visit me because of the COVID requirements and restrictions. And it sounds a very scary and sad situation. Question C, how does the current condition that our society and world are currently in impact the various site agencies, organizations in your community in the long term? So some people feel unnecessary to wear masks, even though there is pretty much, for the most part, a mandate to wear a mask. So I don't know that everyone is going to get used to wearing masks if they feel it unnecessary to wear one out and about. Having to stay 6 feet apart and not being able to go into a business that has already the max people and having to wait, I think is going to eventually cause, and has already caused, an impact. But what I'm really afraid of is a possible depression the country might be looking at in the future, especially with all the businesses that have closed permanently because of the quarantine, and we're not able to bounce back. People that work there now have to look for jobs that may not be out there. It's going to affect the agencies and the organizations that receive donations and government funding that only goes so far. Once it's gone until, the next funding comes in. And so that means they may not be able to reach as many people as they would like to in terms of providing assistance. So that's a really scary thought, and it could have a negative impact on the people that were not ones to get the assistance and have to wait for the next time around. I also worry about food shortages. I don't think it's nearly as bad as it was while we were all in quarantine. I'd go to Walmart and there would be like nothing on the shelves in the deli meats, and it's a really scary thought. The eggs, you know, meats were all very scarce. So it's really scary. COVID cases are still really high. So if we have another extreme spike that was to call, that were, you know, to call for another quarantine, I would be afraid that food would be scarce again, and maybe even more scarce, that, you know, there wouldn't be enough food to go around. So that is something that I definitely think about, as well as jobs. If we have to go into another quarantine, I mean, jobs are, you know, scarce right now because of businesses shutting down. If we have to go into another quarantine and people can't work from home, it's going to cause people not to be able to pay their bills, feed their children, feed themselves. So it just really is a scary situation that I hope starts going into a more positive direction. But yep, that's all I have. Thank you very much. Appreciate your time.